everyone. This is Jamie Marboe-Nichols, and I am the host of the Heart of Dentistry podcast, where we take the ache out and put the heart back in to our dental profession. Please join me as I interview various guests who have opinions and also solutions to what is going on in our profession and helping us put the heart back in. Hello, everyone. This is Jamie Marboe-Nichols, and I am with the Heart of Dentistry. And I'm super excited to have our guest, Alice Stone, join us today. Alice is a diamond in the rough in a lot of ways. She doesn't have a dental background, but I always tease and say people like Alice play one on TV. So, Alice, welcome to the Heart of Dentistry, and thank you for being my guest and joining me.
Thank you. I'm really happy to be here with you.
Yes, yes. So you and I are in DO, Dental Entrepreneur Women. That's how we met.
Yes.
And I have just been in love with your product, your march to helping people and patients in our profession and along with other professions. So tell us a little bit about you, and then we'll delve into the topic that we have today. So tell us about yourself, Alice Stone. Where are you located? How did you get into women in dentistry?
Okay. So it's a very circuitous route, but I live in Boston, Massachusetts, and my career for decades, what I had been focusing on is I'm by training a documentary filmmaker, and I generally makes social issue documentaries. And what that involves is going into people's homes, sort of invading their home with cameras and lights and equipment and putting microphones on them, and then saying, oh, be yourself, act natural, right?
Yeah.
So I happened to mention to my dentist that I really thought of my smile as a tool in my toolkit, because I would make a real conscious effort to kind of beam at people and encourage them and let them know they're doing a great job. And so one day my dentist said, well, your smile would be a lot brighter if you switched to iced coffee. And I said, why is that? And he said, well, you can put a straw in iced coffee and then that protects your teeth from staining, but you can't put a straw in a hot drink. And at the time, all I said was, oh yeah, doctor, I can't wake up in the morning to smell of iced coffee. But I'm a very curious person and I couldn't get past it. And why is it that I enjoy this steaming hot cup of coffee every morning, but as soon as I put a straw in, I scald myself? So I set about solving that problem. And I did. And I came up with a design and I patented it and I learned how to hire mechanical engineers and find manufacturers, et cetera, et cetera. And it's called Sipify. And so that's what it does. It aerates a little bit and it instead of a scalding sip, it's a comfortable hot sip. But I really wanted a charitable aspect to my business. And I wanted to be able to donate straws to a population that would appreciate them. And at the time, I just thought, oh, everyone I know living with Parkinson's drinks exclusively from lidded cups like this one because they experience hand tremors. And so I thought, oh, they must be drinking lukewarm coffee, and the Sipify it's flat, so it goes right through the sip hole. And so I reached out, cold called the Parkinson's organization, and he loved the idea. And he said, well, what's your ask? And I said, I want to give some straws to patients. So it's my good fortune because of where I live, the very first patient he introduced me to who tried a Sipify is a retired professor of otolaryngology at Harvard Medical School. So I go to her house and she says, oh, Alice, it's lovely to enjoy a hot sip again, but I'm drinking everything with this straw because I think it's going to lessen my chances of aspirating. And I said, what? And she said, oh yeah, it's flow limiting and it helps me swallow. And I was just gobsmacked because my mother had multiple sclerosis. My mother had dysphagia, and we were just told to put Thicket in our liquids, and that was it. So I really know what it's like to worry about a loved one choking.
Yeah.
And so I just did a really big pivot because, it's nice to drink coffee and tea all day and not worry about your teeth staining, sure. But, to help people swallow more safely, more confidently. So when I originally launched Sipify, I was really targeting dental hygienists. And I still am, because my personal experience as a non-clinical person, just as a patient, hygienists are all about educating. They
Yeah.
really want to talk to you. They want to know what's going on writ large in your health, your stress level, et cetera, et cetera. And so I thought, well, this is great, because the dental hygienists that I personally know, any minute that they're saving because they aren't removing stain, they're going to be talking, they're going to be
Yeah.
demonstrating.
Time in our appointment with our patients is a precious commodity.
Exactly. So I thought, oh my gosh, what if you had like 3 to 5 more minutes just to go over flossing technique, which I need all the time. I floss regularly, but ineffectively. So I've had these conversations on and on with my hygienist. So that's where I was really focusing my efforts. And then I learned about speech language pathologists who are swallowing experts.
Okay, so let me jump in
Yeah.
here real quick. Tell me, I mean, because this is just taking off in the last 2 years. I mean, you
Yes.
really have just opened up a big old great can of worms, so to speak.
Yes.
Tell us some of the industries and why, or professions that are interested in Sipify. So, like, tell me why. And some of it's going to be obvious to some of our listeners, but maybe not as obvious. And I'm hoping to get this word out to the masses that this isn't just about not staining your teeth. So let's start with the main industries that seem to be really, because you've had some really exciting news lately.
Yes.
Okay, so tell us the industry and why they're so interested in it. Some of it's obvious, but let's go ahead and just pretend it's not.
So I've had a lot of success working with various Parkinson's organizations. I appear in a lot of Zooms where there's a lot of sort of help living with Parkinson's in daily life. And so this is just another tool that people have been learning about. So that's huge.
Yeah, so
Um,
Parkinson's, okay.
Parkinson's, yeah. And then also kind of disability writ large. I've been working with disability organizations. I have several users who have cerebral palsy who
Mm.
tell me that they choke when they're trying to drink
Oh,
unless they're
wow.
using a Sipify. Yeah. And then I have one user who has a bunch of maxillofacial disabilities from a car accident where the airbag hit her face.
Mm.
And because of that, she A, has to drink with a straw, and B, for some reason, she dribbles. So she drinks with a
Mm.
straw, but she dribbles because of what she has going on.
Yeah,
And
she
she
doesn't have the
told me
muscle.
she was the first one who taught me that swallowing is a dignity issue. And she said, what's great
Mm.
about the Sipify is since my car accident, I don't drink in public
Uh,
because it's embarrassing to be dribbling. And so she said, not only can I drink in public, but there's nothing that makes this look medicinal because, again, I made it for the general population. And so she said, we can be standing in a coffee shop together and you're using Sipify because you want to keep your teeth white. And I'm using it because I won't drink in public unless I have it and
mm.
nobody knows the
Oh,
difference.
I love that one.
Yeah.
I love that
So
story.
that's that's a big one for me.
Yeah. Just the
And
personal stories. You could almost write a book about it or a memoir about the different people and how it's affected the quality of their life in a positive way. I love it.
exactly. I mean, I have like so it's for sale on Amazon, and those people who have like found this and it's the only solution, they like put video and they say like, I can't believe my son is actually drinking unassisted, right?
Yeah.
And it's so amazing to me. And I remember one of the first conversations I had with a disability advocate. Well, and he said, this is amazing. Like, we've been trying to get people to pay attention. There's been no assistive technology. Like, nobody cares about swallowing. And I just said, well, full disclosure, like, neither did I, right?
Yeah.
Not that I didn't care, I just didn't know. So I just kind of stumbled upon this and I'm just really going for it. So the populations. So then I got it into a good friend of mine is a nurse practitioner at Dana-Farber, and so she gave it to the radiation folks. And so I have a lot of just kind of patient-reported outcomes because
Mhm.
there are a lot of people who have swallowing issues, maybe even temporarily because they're going through radiation therapy.
Yeah.
So a lot of great anecdotes there. And
Well,
so I,
speaking about that, a
Mhm.
lot of the head and neck cancers that we know about, we get in prosthesis, once they've gone through it, if they've had to have part of their jaw removed or, whatever it might be. And it's a lot of it's disfiguring and they're going back to what even the car accident person that's using it, there's so much dignity that's lost in general, not to mention even just the nutritional side of things if they can't chew because of head and neck cancers and they have to get their calorie intake through a straw. And so hopefully this is helping with that too for a nutritional standpoint.
yes, and I've also been told that it's helpful for Parkinson's patients because they are at very high risk of dehydration.
Mm,
And it's a constellation of symptoms. So clearly not everyone with Parkinson's, but many people with Parkinson's, for some reason, the disease really inhibits their thirst mechanism from kicking in. So they don't feel
mm.
thirsty, and then they choke and they have issues drinking, so they don't drink as much water. And then that, of course, besides just general wellness,
And
your
some of the
medication doesn't
medications,
work.
the medications are probably causing some of this.
Maybe, but also if you're not well hydrated, the medicine isn't going to get dispersed and it's not going to work
Yeah.
as well.
Yeah.
So
And then
the
didn't you
other,
just sign, isn't there a department in one of our major medical communities that just signed on with wanting to use a study
oh
on
yes.
Sipify?
So yeah, I mean, I mean, I think I can say this, but basically through my networking and through my dear sister Debbie Galuppi, I met
Woo,
a
we love Debbie. She's a connector.
yes. I met a speech language pathologist at one of the Mayo clinics, not the main one, so I won't identify it. But she, what's great about the Sipify is that if you're a typical swallower, you can use it and see instantly that what it does is it delivers a smaller, slower sip. And that's what you need when you have dysphagia. And it's very hard to teach someone who's been swallowing for 70, 75, 80 years. You don't even think about it. It's just instinctual.
Mm,
To ask someone to change the way they swallow is a hard sell. So the
yeah.
Sipify just does that for you. So anyway, she was so excited about it that, she asked if she could just do a small research study. So I sent her a bunch of straws, and they are primarily helping people with head and neck cancer. But
Mm,
she is looking to see who's coming in for video fluoroscopy, which is a barium swallow test. You drink a certain amount of barium, and then
and
it's
then
like
they
an
watch
X-ray,
it in
but
the
it's a
CAT
video.
scan.
So you can
Hmm.
see exactly what's happening with the liquid. So what they're going to do is if you're already coming in for the barium swallow test, so there's no increase in radiation exposure. If you're already coming in, they're just asking, can you take a couple of sips with the Sipify?
I love that.
So I am going to get real data instead of just being able to, give patient-reported outcomes.
Yeah.
So that's super exciting to me. I have one medium, one barium swallow study just from someone who uses the Sipify and has cerebral palsy and loves it and has sent me photos. And I love this. She has sent me photos of her using the Sipify, getting a beer at a pub. Because
Oh,
yes, people with disabilities enjoy alcohol as well. There's nothing wrong
right?
with that. So
Of course not.
she brought it to her. She has an annual swallow study. And so she
Wow.
sent that to me. So I like have one, where it says, yes, the Sipify did reduce the bolus of the swallow, et cetera, et cetera. But
Yeah.
this woman at the Mayo Clinic is going to have, kind of
The actual data. They're
actual
recording
data,
everything.
yeah, that she's hoping to publish. And then I'm also in conversation right now with the University of Cincinnati. Same thing.
Oh.
Um, uh, their head and neck cancer dysphagia lab. The principal
I love
investigator there
it.
wants to do a clinical trial.
I love it. So talk about, I mean, your product is the epitome of my statement of my podcast of, taking the ache out and putting the heart back in. And so I love this because we don't know what we don't know. And little did you know that your somewhat self wants and desires turned into something that's helping. I'm hoping thousands, if not millions, of people out there that are suffering from various diseases and things that are making their life not so great. For
Yeah.
common, we take it for granted swallowing. We really, really do. A lot of us. Um, I love this. How let our viewers and our listeners, how can they get a hold of you? We're going to have it in the recording notes, so you guys will to you don't have to memorize it. But how do people get a hold of you, Alice?
Sure. Well, so because my journey took such a left turn, I have two websites. So you can find me at alice@sipify.me or Alice at sipcontrol.me, SIPCONTROL.me. And that is all about the dysphagia.
Okay.
Because that's the promise of the straw. I can't make any medical claims, but I can say, you will have greater sip control when using the Sipify.
And they can order this on Amazon, you said.
Yes, it's also on
Sipify. So
Amazon. Yeah,
Sipify, Sipify
Sipify. Yeah.
on Amazon.
Yeah. And
So
dysphagia for many years. Well, first of all, one of the really curious facts I learned that I'm sure many people in your audience might know is that in order to swallow safely, 50 muscles have to work in coordination.
wow. Yeah. I'd
And so
forgotten
what
that
happens?
stat from my early on hygiene days.
Yeah. So what happens is, as we get older, the same way that our gait gets a little off, those muscles don't necessarily work in coordination. So people in the dysphagia field, it always used to be secondary to another condition like Parkinson's or MS or head and neck
Mhm.
cancer. And now they're really viewing it as a gerontological issue.
Oh,
And yeah, and they're changing the protocol, and gerontologists now, when you hit a certain age, I think maybe like 75, they start asking you, are you having any trouble swallowing? Because people don't even think of it as something they should be reporting to their doctor or their dentist.
yeah. Well, it makes me think about it because my husband chokes all the time when he's drinking. I just swallowed wrong. And I'm like, that's not right. I mean, I'm talking 2 and 3 times a day when he's drinking that he'll just start choking. So I'm gonna have to definitely, I'm surprised I don't have one yet, but I definitely need to order some for us if he'll take the time to use it, but which I know he will because he knows that he wants to not choke any as much anymore. So that's great. Well, thank you for joining us. And I am so excited to get the word out from our podcast and our viewers. And if you have any questions, you can reach out to me and you'll have Alice's information in between what she said and in our recording notes. So thank you, Alice. I appreciate it. And we'll talk with you again soon. Thanks,
Thank you,
everybody, for
Jamie.
joining
Bye,
us.
everybody.
The Heart of Dentistry podcast, where we take the ache out and put the heart back in to our dental profession.